Hello, everyone. We are going to get started again. I'm going to just stall for a few seconds so that people can come back to their computers and get settled in again. Once again, this is Darn's conference about teaching about disability. And I'm Kathleen Bogart, one of the leaders of DARN. I hope you've been enjoying our conference so far. As a reminder, recordings from this event will be available on DARN's website, and that's darndisability.org. You can learn more about our organization there. So I'll go ahead and introduce our next esteemed speaker, Dr. Thomas Dirth. I'm proud to have known Dr. Dirth for many years, since some early days at SPSP, the Social and Personality Psychology Conference. And it's been wonderful to watch his career develop as a social psychologist. So, Dr. Thomas Dirth is now an associate professor of psychology at Bemidji State University, and he describes his scholarly interests and priorities as distinctly shaped by his experience as a physically disabled person. And they include domains of diversity and multiculturalism, stigma, stereotyping, prejudice, discrimination, and the social identity approach to advantaged, disadvantaged identity experiences, in conjunction with a wide range of disability-related phenomena elaborated within the interdisciplinary field of disability studies. And he is passionate about teaching coursework that incorporates multicultural and marginalized perspectives to critically consider the psychological knowledge base. He is an advocate for greater access and inclusion of disabled perspectives, including faculty, students, and staff in higher education, which aligns perfectly with the goals of this conference. So I'm going to welcome Dr. Thomas again, or Dr. Thomas Dirth, and I will turn it over to him.
Thank you very much, Kathleen, for that introduction. I'm very honored to have been invited here. I will start out by just kind of giving an overview of what I hope to consider over the next 45 minutes or so, and I will make sure to leave room for questions, hopefully at the end here. Um, uh, some of the stuff that we'll consider early on here is observations about cultural competency in psychology, and I'll kind of introduce my position and my context for this. I'm going to talk generally about why we need this inclusion of disability into a multicultural approach to psychology. This will include, I'm sure, information that will be widely shared during this conference, statistics and whatnot. I'll talk about the challenges of including disability in cultural competency and multicultural approaches. And then I'll share with what I do, just as far as my perspectives about thinking about disability across psychological curricula, both within a class that is specific to disability, and then also a few additional basic or core psychology courses. So when we talk about multicultural competence in psychology, this is something that it has been now about a decade at least, in terms of the APA emphasizing the importance of multicultural competence in undergraduate education. As Sue puts it, the multiculturalism is the ability to engage in actions or create conditions that maximize optimal development of diverse identities at individual and systematic levels. And so here, multiculturalism has been a big force and a paradigm shift when we start to think about the context, the individual and systemic context of people and how they develop within these diverse spaces. There are, within that goal 3 of the APA, there are a number of guidelines that speak to issues of intersectionality, culturally informed research, the importance of language and communication, and the role of social and physical environment on life experiences. And so when I was hired back in, I think it was 2018 now, I've been at BSU for going on 6 years. This was a position that was new or created by the BSU psychology department to support multicultural coursework in the psychology program, to be proactive and to think about how we are training students to be multiculturally humble and competent, whatever the terminology would like to use, as they progress into advanced psychological training, graduate school, internships, and the like. And so one of the things that I saw in the program description was the work that I do with disability and in social psychology as a key contributor to multicultural education. I was able to articulate my work and my interest as a multicultural focused psychology. I am interested in the ways in which disability intersects with identities, in which we can leverage insider experiences to inform research. I spend a lot of time in thinking about the importance of language and communication that is informed by disability perspectives. And as somebody who leverages disability studies perspectives and critical models of disability, which I will, I'm sure many of you are familiar with, but I'll lay those out in a little bit. The role in social and physical environments in the life experiences of people with disabilities is very conspicuous. It's something that really informs the experience of people with disabilities. And so in the work that I do, I see this as a really advantageous experience to teach multiculturalism to general psychology students. It has plenty of tie-ins across multicultural experiences, but I wanted to bring my own experience to that. So why do we need this specifically as it relates to disability? Beyond just the advantages of leveraging disability experiences to really have well-rounded multicultural focused psychology training. Well, one is people with disabilities. This is a fairly a matter of fact statistic that they comprise almost 19% of the non-institutionalized population of the United States, nearly 57 million people nationwide. And since the passage of Americans with Disabilities Act, and even going back to the Rehabilitation Act of 1973, people with disabilities are increasingly pursuing post-secondary educational opportunities. An estimated 11% of undergraduates have a disability, indicating that they are underrepresented in higher education, yet still a substantial minority. We have a lot of students with disabilities who want to be professional psychologists. And undergraduates with disabilities are unfortunately less likely to complete their degrees than those without disabilities. So here we have a situation of disparity for students with disabilities looking to pursue psychology. Why is this? Well, as several of the scholars and Darn and others have noted, there's a lot of disability underrepresented across the psychological curriculum. So we're seeing when we understand the students that are coming into our courses, they're not seeing themselves in the curriculum. And so when we think about this as a issue of representation, how do we support students with disabilities entering into our psychology workforce, our field, at a higher rate? I anticipated the underrepresented in the coursework just a bit there. The prevalence of disability content in coursework suggests that they're not seeing themselves actually in the knowledge base of psychology. Less than 20% of undergraduate psychology programs include courses on non-psychiatric disabilities. Disability-related content in graduate programs typically focuses on exceptional children, intellectual disabilities, and developmental disabilities, or learning disabilities and language disorders, and graduate psychology programs about disability. Although this is around the turn of the 21st century, has this decreased up to that point. The statistics over to our right, or the table to our right, indicates the overprevalence of psychiatric and cognitive disabilities experienced in or seen in those psychology textbooks. This is really, and as we look at the content specifically, it's often limited and stereotypical, as as Nicole Rosa, who's one of the panelists today, found in some of her work and her colleagues' work. It's predominantly found in sections of biology, thinking, intelligence, language, sensation, and perception. Essentially, what goes wrong, framed as what goes wrong with normal human psychology. And most illustrations representing disability are meant to visually represent types of disability or treatments associated with them. There's very few text or visuals that include people with disabilities doing something unrelated to disability. So for instance, just showing that people with disabilities are an everyday part of human life, a diversity representation. Okay? So what this is essentially in a nutshell is showing is that psychology still has a struggle with trying to treat people with disabilities as opposed to include people with disabilities in the psychological knowledge base. So as we think about these challenges and solutions, one of the biggest things to think about is the predominance of the medical model in disability. Disability culture, identity, et cetera, is often overlooked within multicultural and social justice initiatives that exist currently in psychology. And because by defining disability as an internal pathology in need of a cure, the medical model fails to address disability as a positive identifier. This is something that has been articulated, or this critique has been articulated a number of times across the decades by folks understanding the disability experience, bringing disability studies perspectives into the psychology knowledge base, and attempting to reframe disability as more than just a obvious medical issue that needs to be treated, or a pathology. We've shown significant benefits here, or progress here, with the recent last year's passage of the APA guidelines for assessment and intervention with persons with disabilities. Folks that have been part of the DARN circles were involved in this task force that provided these guidelines. These are guidelines for developing disability cultural competence by the practitioners, and they are include but are not limited to guidelines like self-reflection of possible implicit biases towards people with disabilities, considering potential ableist beliefs and views that may underpin negative reactions towards people with disabilities, becoming familiar with disability resources within one's community, and integrating disability-related case material on topics into professional discussion, study groups, courses, and seminars. Essentially, we are growing and taking the approach that representation of curriculum needs to move towards promoting a set of guidelines and a set of objectives. And so, in my opinion, or this is something that I've found in an approach in some of my work, is that we need to continue to develop framings of disability in psychology that allow for or promote these kinds of objectives and goals. It's not enough to just say it. It's got to fit within our general approaches in psychology, or the framings of disability in psychology. And this starts with combating the medical model. Not to say that as I tell students, not to say that the medical model doesn't have its uses. I have benefited from the medical model of disability. I've had numerous surgeries. I've had, implanted devices to help regulate my cerebral palsy. And certainly I appreciate the medical model as far as the training and going in and handling the biophysiology of my impairment. That does not mean, though, that my life is driven by this. I am more than those hospital visits. And that's a very important thing that all professionals should understand. And so this traditional formulation of disability is an objective medical condition. And it inherently pathologizes the disability. It sees disability as inside the person, as an objective condition that is idiosyncratic to the individual. And so what does this do as far as shaping psychological investigations? Okay, one of the things that the medical model does is it tells us what about disability is most interesting and in need of further investigation. Okay, so it directs our attention. And this is why we're calling these models, or why disability studies often refers to these as models, is because it shapes how we approach disability. It also talks about what qualities of a person with disability should receive primary attention. So it lists the priorities about what is the urgent issues that need to be addressed. How should a disabled person feel about themselves? So it shapes assumptions about, well, if the disability is the problem or the impairment is the problem, then people with disabilities should not enjoy that problem. They should not be okay with the problem. They should be working to overcome it. And it suggests how should a disabled person feel about each other. Well, if there's a sense in which if it's an idiosyncratic issue of diagnosis, and my diagnosis is unique to me, then I feel no sense of solidarity with others who have unique issues of their own. There's no sense of solidarity. There's no sense of shared experience. And so here the medical model also distances people with disabilities from each other. So interdisability studies, this is something that I always mark, because this is something that was very important to me in graduate school. Coming to disability studies as a person with a congenital disability for about 20 some years, I did not realize that there was this area of scholarship called disability studies that brought to mind and brought up the priorities that people with disabilities perspectives matter. I spent my whole life being socialized into this idea that disability was something that I should not be okay with, or that I should struggle to overcome. And so a area of scholarship that actually thinks creatively, or uses disabled perspectives to think creatively around a variety of issues in the world, was just revolutionary to me. And so disability studies is a perspective that can be applied across disciplines. It's transdisciplinary. It's not necessarily any limited to any specific disciplinary focus. It prioritizes the idea that disabled people are insiders and experts, that disability is irreducible to the biological condition. It imagines disabled people as a marginalized political group, a minority group that has legitimacy in number and in agency, political agency. And it is a vantage point to examine other ways of being. So when we think about critical perspectives, when we center disabled experiences as just so, we think we can then call into question other ways of being as being abnormal, as opposed to centering normal and thinking of people with disabilities as abnormal, so to speak. So what does disability studies do in my work, and how do I use it? I talk about leveraging disability studies a lot. Well, it allows us to think about these critical perspectives. Again, centering disability and thinking critically, or turning the lens back on the taken for granted norms. Disability models in general are simply ways to conceptualize disability and disability experience that gives us a framework for understanding the complex relationships among individuals, disabilities, and outcomes at the personal and societal level. Okay? So when we think about disability models, they're a way to think through or flip through a number of different vantage points in order to analyze common disability issues that we might be teaching about in our psychology classes. And so that is what I am offering, and what I'm bringing to the table is how I do this specifically by engaging these different models, or models specifically. Of course, as you look through the literature, there are quite a few more disability models mentioned. I kind of just my own preference is to look at these four models because I think that they incorporate uh, a variety of issues that exist in these other models. And if you get too many models, then it's no longer parsimonious for students in the class, and it can get carried away. And ultimately, this is about the practicality about bringing disability into that multicultural context. So the four that I use here specifically are the sociopolitical, the social, the affirmative, and what I call a critical or ability model. And so the sociopolitical model asks us to think beyond disability as an apolitical or isolated experience. Again, when we consider intergroup psychology, it's important to articulate a group, a shared experience, a minority group experience. And so this is what the sociopolitical model and work that has been done with the sociopolitical model actually has done across disability studies, is it's articulated disability as a political group, a group with political agency, minority group, as I'll talk about in just a second. It also thinks about disability as a disparities group, a group that experiences broad scale disparities in social domains. It's not just an individual having a negative experience, it's a group. The social model is one that we've all, I think, hopefully we've all heard of before, but this is thinking about disability limitations as thinking beyond disability limitations as located in the individual. So we are accentuating or amplifying the role of the social situation, the presence of other people as imposing barriers or limitations above and beyond one's impairment. That's the original articulation of the social model. The affirmative model is thinking beyond disability as tragedy. So I tend to think of this as the diversity model, or the affirmative, others have called it the diversity model. But this is thinking about disability as value, as adding value, as thinking about the creative opportunities and the unique lessons that disabled experiences teach us. And then finally, the critical or ability model is thinking about, instead of thinking about disability as a disadvantage or thinking beyond disability disadvantage, we're thinking about or challenging ability advantage, thinking about privilege of ability, thinking about the taken for granted structures that create ability and as a consequence disable other people. And we'll get to that in a second. But that one's a little bit more towards the end of a course, or thinking more about ability as a, calling that into question. It's a little bit of a mind, it's something for students to wrestle with, because oftentimes they don't think about ability as anything other than just natural. So let's start with a socio-political model. Okay, this introduces the legitimacy. Again, I'll kind of reiterate a couple of these points. This introduces the legitimacy of disability as a political contingency and equity disparities group, and it emphasizes the legacy of people with disabilities as agents of change, and shifts prioritization for self-determination and disability-directed advocacy. So ultimately, what we're doing again is making disability into a group. Okay. In my disability and ableism content, so this is the class that's specifically about disability. One of the things I do initially is to talk about disability as a marginalized group with a history. So we think about the historical legacy of disability as a group, the evolution of the disability rights movement. We think about disability as a concept and that the presence of people with disability over history. This also includes things like etiquette and terminology. How do people with disabilities want to be called? and really getting into psychological research methods and disability inclusion in that. Again, to reiterate that this is a group of people. This is a shared experience, and it informs a lot of the work that we do. And so, making sure that we establish a group with a history is really, really important and oftentimes groundbreaking for students. They're not aware of the disability rights movement. They're not aware of the legacy of people with disabilities in psychology, or the ways that psychology has historically oppressed people with disabilities and actually had a role in creating disability in the first place, or defining disability in the first place. Okay. Um, I mentioned I want to go back just real quick. We watched the documentary Crip Camp, which I think is a great introduction to the disability rights movement. It introduces Judy Heumann as well, who we sadly lost this year. But this is something that really fosters a sense of connection among the students to the agency and political power of people with disabilities. Now, beyond the disability class, I think it's I've seen the benefits of the socio-political model in health psychology specifically, and I'm sure maybe some of you have seen more recent advancements in actually getting people with disabilities to be termed a health disparities group. And so in health psychology, it's an important task to define health and apply analytic perspectives to assess factors that impact health. Traditionally, it always seems to be that disability is equated to a poor health outcome. But from a socio-political perspective, we're able to reimagine people with disabilities as a just area of human diversity, but one that experiences health disparities as a population. So thinking about secondary health consequences that affect people with disabilities more than others because of the ways that they're treated in society, the lack of access, the lack of employment, all of the social determinants of health. And so here it's a simple shift based on using this model, but it really opens the door to helping students understand how important it is to take this new analysis on a disability population. And it isn't possible, in my opinion, without leveraging the socio-political model in the first place. All right, the next one that I tend to use is the social model. This one is definitely intro to disability. Disability being this is one of the older models. It's locating disability in environmental and the social world as opposed to the individual. This is one that has been said to kickstart the disability rights movement because it relocates responsibility onto society for changing things rather than the person. It allows a sense of blamelessness for people with disabilities to say it's actually it's not something I should be ashamed of. It's something that you should have a role in fixing because it's not my problem. It's society's problem. So within my disability ableism class, one of the activities that I like to do is have them consider the external factors that interact with impairment to create barriers and limitations. And so these, as a social psychologist, I spend a lot of the time talking about stereotyping, prejudice, and discrimination and stigma. This is something that folks in the DARN group, and I'm so thankful, heard Michelle Nario Redmond talk earlier. Her work has been such a, standing on the shoulders of giants to be able to have the shorthand for things like stereotyping and prejudice that she has done work on. But I also try to get I have an experiential learning activity for them that has them evaluate built environmental factors according to the ADA. And so this activity is something that it approximates a disability simulation, but it is not a disability simulation. They're not trying to go about the world as a disabled person. What I'm trying to get them to do is have more awareness, acute awareness of the different ways in which an environment can pose a problem and the ways in which we have legislation, we have regulations that are supposed to affirm and ensure that these guidelines are met. So students are instructed to go to places they would typically go for leisure or entertainment and their place of residence. So that's another one, and evaluate each location according to the ADA guidelines. And so, if it's an in-person class, if it's a small class, I give them the tape measure. We also have door pressure gauges, which are pretty fun and to establish what doors are too heavy. And then they complete a reflection and application questions related to the activity, oftentimes applying content from stereotyping, prejudice, and discrimination to the impact of the built environment on those phenomena. I've done this a couple of times, and evidence from the classroom in terms of qualitative analysis indicates that this is a tremendously effective experience for emphasizing the social model. There's increased awareness and indications of it being a transformative experience. There's more focus on the built environment or social model framing. I also have quantitative measures that I use for this. A slider scale that has medical model at one end of the pool and social model at the other. So descriptions of those, they tend to move quite significantly towards the social model. There's more prescriptions for action. So they're able to see action that needs to be taken towards this end of the disability issues, as opposed to, say, things that are internal to the person. There's more positive social emotions that are indicated without necessarily reaffirming stereotypes. So when we talk about disability simulations, one of the things that happens is if you're rolling around in a wheelchair and you're not used to it, it makes it seem like people with disabilities are in a more tragic position. That's so unfortunate, so hard. This doesn't have that drawback. And it also, we have had a few of these, and this can be pulled out in discussion of thinking about the privilege or advantages for able-bodied people when it comes to living in a society that does not have accessible features, right? If certain people can come and go more easily, that allows more access and more privilege for those individuals. In a quasi-experimental study, just to add to that, we actually did a more controlled study with this. And so we had them do basically the same kind of paradigm that we do in class, only we had them go to the same locations. And what we found quantitatively, again, is that in the intervention condition, there was significantly more endorsement of the social model, significantly more perceiving ableism. So that variable includes, essentially saying that it's whether or not an ambiguous differential treatment towards people with disabilities is ableism, or if it's not ableism, they're more likely to be sensitive to these issues and call them out as ableism. And in the stereotyping condition, or in the stereotyping variable, the control condition has significantly more stereotyping of people with disabilities than the intervention condition. So that indicates that this paradigm is working and it is doing something for participants and students to really emphasize that social model and to think about the external consequences of disability. As it relates to other coursework besides the disability and ableism course, this is something that I taught research methods, stepped in to teach research methods a year ago fall, because it needed to be covered. And so what I actually did was I had the students in research methods do that activity and then inform their research questions based on that activity. So essentially taking a shortcut to using the social model of disability to inform research questions, as opposed to just leaving them to their own devices, which often gets those medical model informed research questions. My strategy was I was trying to rein in the plethora of research questions that can come up within a research methods class, And so I thought that this would be a good opportunity to do that. It also allows for an opportunity for them to practice asking a question that is more culturally responsive for people with disabilities. And I actually gave them information about that, the APA guidelines and all that. So this becomes something of a shortcut or a hack to get students to make these more culturally responsive questions. And so some of the research questions that I got, if you look through these, this I wasn't prompting, or I wasn't salting the jar, so to speak, about what these questions were. They just did the activity, and these are some of the questions that they came up with. So, for example, how might a university's level of disability awareness impact the level of attraction students with disabilities might have towards that university? Okay, so thinking about external factors that might impact students with disability coming to a university. What is the relationship between experiences of ableism and mental health, right? Instead of thinking about the mental health consequences of an impairment experience, they're thinking about the experiences of ableism as affecting mental health experiences. Does the perceived accessibility of a location influence beliefs about the ability of blind people to live independently? Okay, so here again, we have accessibility as affecting these issues as opposed to the blindness itself. And then how does accessibility within a store alter their sense of belongingness and the likelihood of people with disabilities wanting to return? So I just found these to be so gratifying, these research questions, among others. I certainly pulling those that are that were the most constructive, but I just see this as such a step ahead for what students might be coming to initially. And this is all founded on this making people aware of the social model. Okay. The next model, the affirmative model, seeks to affirm both disability and impairment as a positive experience of one's identity and experience. It helps move towards a non-tragic view of disability, and it emphasizes disability experiences, examines diverse ways of managing stigma and developing positive identity. And so this is the module in the disability and ableism course where I talk about things like quality of life, identity development. We explore the social identity approach to disability and talk about stigma management strategies, and especially emphasize social creativity and social competition that allow for people with disabilities to have pride and to have creative solutions and to have empowering experiences, and not just a sense of how are people with disabilities coping with their tragic experience. That some of the historical work on coping with disability has done. And so we are able to talk about disability pride, sub-communities, disability arts, the full plethora of this. And because we are attaching this to this idea of diversity and these experiences of pride, we're also able to then think critically about intersectional experiences of disability. It opens the door to say, ask questions about how is disability different when we consider intersecting identities of gender, of sexuality, of race, of rural versus urban. There's a number of different ways to think intersectionally about disability, and the affirmative model allows us to do that without assuming a tragic experience. It is something that brings us into contact with a more understanding and opens the complexities and the challenges of these issues without assuming a tragic or a negative experience. And if we take it out of the disability and ableism class to a more general coursework that I teach, social psychology, one of the things that we talk about is introducing the needs of the social self, including factors that pose a threat to the self system. And so again, this is something that we can introduce the idea of stigma on the self and bring in disability as a commonly stigmatized group. And then we can use the stigma management strategies in the social identity theory to establish stigma as a dynamic with a dynamic approach, and people with disabilities as and talking about the contextual and personal features that might empower people with disabilities to resist stigma and engage in social change. So instead of there being a sense in which people with, who are stigmatized as being always and everywhere stigmatized, as traditional frameworks do it, this is a way to show how stigma can be productive of social change and what are the factors that actually get us to a point of collective action and changing the status quo. And that can be then generalized to other groups as well. And I think I definitely see in discussion as we relate this and generalize it out, it really gets students thinking about their own, maybe their own stigmatized experiences and the ways in which there can be different organizations on campus that create more of these group level coping strategies that are more productive of social change. All right, lastly is the critical ability model. This is something that in working with Glenn Adams when I was at KU, I took a lot of the cultural psychological analyses and perspectives that are the lab, the cultural psych research group, and he and his collaborators would do. And I think a lot about turning the lens back on ability. So to sit in the disability seat and then to turn the lens back on ability and challenge the just natural nature of ability. And so this area examines ableism, the set of beliefs, processes, and practices that reproduce the just natural superiority of abled ways of being. So this refocuses on ability advantage rather than disability disadvantage. One of the content features is this documentary called Fixed, the science fiction of human enhancement. When we think about ableism and abled ideology, the area of transhumanism is a nice exemplar for ableist assumption and ableist ideologies. We also talk about a critical work from Fiona Kamari Campbell and Greg Wolvering about ableism, articulating that. We talk about privileges of ability, and then we try to talk through abled values. Where are there values of ability in our everyday life that are just seen as okay, as fine, right? So productivity, efficiency, timeliness, individualism, strength, growth, development. There's a variety of features and values that we take for granted in our everyday life. And so some of the activities that we do is just trying to think about alternatives. So instead of independence and autonomy, think about the value of interdependence. What does that mean? Instead of productivity or growth, think about sustainability, right? And so there's a number of different areas that we can get into. But it's more exploratory. It allows for just some critical thinking around these issues. And within psychology, this is a very important discussion. When we think about this in introductory psychology, I don't teach introductory psychology as much, but I think that this is an important task in introductory psychology to establish a narrative for what phenomena psychology considers, what psychologists do, what the psychological enterprise is all about, and how we come to know things in psychology. So for example, there's an opportunity to engage with this model to open discussions about the just natural nature of psychological ability and the weird WEIRD normal standard that serves as a foundation for contemporary psychological insights. So we think about when we establish the weird normal standard, others become disabled accordingly. But that standard is something that is weird, right? And so how do we challenge those standards and what is it about certain abilities that we see as good, not good, value? We can also consider discussions about transhumanism and psychological enhancements in these classes to encourage students to think about environmental, social, and structural correlates of ability. Intro to psychology is something that, historical narratives put it all up here. And so how can we challenge that ableist thinking to think about how are some of our psychological processes afforded by environmental, social, and structural correlates of ability, including economic status, including environmental affordance. So those are a couple of different insights that you can leverage in introductory psychology to really open the door to thinking about disability and ability in critical ways, and introduce disability as a creative jumping off point, a vantage point to bring that experience into introductory psychology. So I'll just say a couple of concluding thoughts here where I think we're right on time projected. The goal of this project, or the goal of my work in general, I wouldn't call it a project. This is kind of how I work, and when I'm developing coursework, is to advance culturally informed training of undergraduate students in psychology as it relates to disability experiences. We know that our students are going to go out and work with people with disabilities. People with disabilities are the largest minority group in the country. So we need to be able to prepare them to think critically about disability. These efforts are fundamental to reducing disability stigma in our field, especially among future practitioners. So as I'm thinking about these things, I'm thinking about the disabled student in my class that has not had the opportunity to feel proud of their identity, because there are not these things to be proud about, to hold up and say, oh, this is actually an experience that adds value to psychology. And we must continue to bring together existing perspectives and strategies dedicated to this same project. And so as we continue with research, with basic research about theory, it's important to bring together these perspectives and add to this project. And so this four model approach, it's a little schematic. I just think it's a schematic to focus on framing disability topics and experiences. It's not as much about the specific content that you would use, or it's not, there's a lot of different things that you can do with it, but it allows you to frame disability in ways that are more suitable for advancing multicultural competency. So if what you're doing doesn't plug into one of these models, it kind of it can give you a little bit of a pause to say, how can I put it within one of these models, right? And so it allows for that schematic or shorthand to catch yourself if you're not doing culturally competent inclusion of disability at the work. So it's important that advancing this project also includes increased representation and the voice of people with disabilities in the classroom. Having people with disabilities in the classroom speak to that experience, guest speakers, going out into connections to community, etc. Class materials, first-person perspectives, memoirs, things like that. This is not a substitute really for that. Or it can be an actually excuse for you to do that. Where you are getting the affirmative model out of a first-person narrative, a memoir for somebody. And so that can be a reason why you would include that. Likewise, universal design for learning, accessible class materials, course delivery, reducing those barriers is also going to be a key feature of this process. It provides you a lot more advantage when it comes to including students with disabilities in the psychology curriculum. So I will leave it there. I have some time for questions. I want to thank my student, Lily Walker, for her work and direction on this project. She took the disability ableism course. She was interested in clinical psychology, and she said, I really want to work on making clinical psychology more accessible, the curriculum more accessible for students. So she, pushed me to put these ideas down and actually move them forward. So I think Lily, and she helped a lot with this. So I think Lily quite a lot.
Okay, well, Dr. Dirth, thank you so much for that presentation. I'm seeing a lot of claps and accolades in the chat, and several people have said they wish they could take your class, and I agree. um, and we have some questions in the Q&A as well that we have some time to address. So let's see. The first one that I would pose to you is how does the idea of multiculturalism in APA similar or different to intersectionality as recognized in disability justice?
So this is just my take on multiculturalism and the way, because I teach a course called multicultural psychology, and so I'm thinking about psychology at the intersection of a variety of different experiences. Um, uh, Intersectionality itself is, the intersection of a lot of experiences among a person's identity. We also are thinking about a um, psychology at the intersection of diverse people coming together. And so, how do these issues, how does psychology work when we have to take into account of the complexities of sociality, of intergroup relations, in different settings? And so, the idea of intersectionality and disability justice certainly can inform that, and I think it does here a little bit. Um, it is something that my intellectual bias tends towards intergroup relations and intergroup conflict, and thinking about this from more of a, the minority group psychology perspective. So I'm not as comfortable, or I'm trying to get more and more informed about intersectionality and the intersectional experience of individuals. And so I think that's a good question, and one that I'm interested in knowing more about, and bridging the two. I think that, but I think the take home would be that this is why disability is such an important experience to inform multiculturalism and psychology overall, because it encapsulates a lot of the challenges and a lot of the unique contours that multiculturalism can paint over if it's not careful. And so, without disability and intersectional disability experiences included, or prioritized, that'll be a limitation.
I think that's a great answer. And so we have several more questions that just came in that I think are really good. So one is from former student of mine, Kramer Callum. Hello, Kramer. What advice do you have for psychologists who work in academic medical settings? How can we encourage others, for example, research faculty, providers, students and trainees and patients, to appreciate and incorporate these four models in an environment that centers the medical model?
Yes, and this is something that I've had to think a lot about, because I'm actually I do talks across the university. I have a colleague who does anatomy and physiology, and a lot of the students are going on to be therapists and doctors and whatnot. And so I talk to her class quite a bit, and it's the challenge of why, all the students say, why should I be interested in this? This doesn't matter to me, because I'm just, looking at the muscle. And so I think for me, this is something that I have come around, the idea that the medical model is one of the models. It shouldn't be excluded. But if you can't think about disability experiences these varieties of ways, and the fact that you're going to be interacting with people, that's why you should care about these things. So being aware of disability culture, being aware of the social model, the socio-political model, understanding the environmental, the role of the environment, and thinking about alternative ways of being. So oftentimes my struggle with, like, therapy or physical therapy and that is we so often believe that there's only one way of doing things, and it's better to walk than use a wheelchair, right, or something like that. And I think that in and of itself is such an advantage for these professionals, um, providers, patients, to be able to leverage disability experiences as maybe it's better to do it this way, or maybe it's equally good to do it. There's a variety of ways to do things. So it's like thinking outside of the box and challenging the norm. And so that's what I communicate to providers in medical settings is it's about critical thinking skills and thinking critically about disability and not just taking it for granted, right? And so that's what these in different ways these four models approach that, and they are able to center disability experiences to see the world differently, and that can be an advantage across their experience, and not even just with working with uh, clients with disabilities.
I think that's a really excellent answer, right? We want doctors to think, about the medical model and their training, but much beyond it, and do that perspective taking and ensure that the perspectives that are being shared with them do center disabled experiences. Okay, here's another question that I relate to a lot, and I wonder about when I'm supporting my students. How can we address issues of internalized ableism, particularly in self-help or self-advocacy among students in higher education?
Yes, this is such an important one, and I think about this with the ways in which, or the patterns that have led to internalized ableism to get to that point. Internalizing ableism and internalizing stigma is a process. And it's because of the dominant cultural views, the idea of othering people with disabilities, such that there's no recourse, there's no way to combat that. And so either you go along to get along, using that stigma management strategy of like social mobility, or you kind of fail and internalize the stigma, you internalize the negative beliefs. So we need to create personal and contextual features that are going to encourage more of that collective response. One way of doing it is to inform people with disabilities, or make it more common knowledge, things like disability history, disability culture, just being aware that there's a community out there, and that there's agency. So that's one way of doing it. But I also think representation matters. Being able to latch on to a meaningful category is a really good part of this. So within classes, um, even the communication of the accommodations can be something of a you can tinker with that so it becomes value added. It can become something that is white space rather than something that's at the end of the syllabus that leave unstated, right? And so it becomes a norm that disability is a part of diversity, and not necessarily something that we need to be ashamed about. And so I think that the terminology that is used, the way that we talk about it, allows for identity safety within these spaces. And ultimately that's what we try to do is make us identity safe spaces so that people can explore and develop, which is a time in college that you have a lot of identity development here. It's not going to happen all at once. You have to overcome that internalized stigma quite a bit. But if you have the safe space and you know that there's supportive people around, that gives people an opportunity to move in that direction or explore it. Sometimes it just needs to be about introducing people to their communities, or making people aware that these communities are out there. Sometimes like with me, I did not know that any of these communities were out there until I entered my PhD program. So, that's an opportunity that you can introduce your students to these communities and bring them in contact with these. So
Excellent answer. And yes, the key value of community is so important. And yes, I relate to you. I didn't kind of learn about disability community and disability pride until I was entering graduate school as well. And of course, that's why we're here today. That's why Darn is here. We're here to help students kind of understand that there is a community, and there is this history to be proud of. So with that, we are at time. So thank you so much, Dr. Dirth, for your presentation, your really thoughtful answers to questions. If there are remaining questions, as I mentioned before, we will address some in our final session on Saturday at 4 p.m. Pacific.